but that is only for that level small level hospital. I mean, small level clinics, health centers, and health posts. So what about the big hospitals? What about a hospital like Levy, UTH, cancer disease, these provincial hospitals? That now is a different ballgame because the drugs there, those are mainly essential drugs.
Is this now how you went to Egypt?
Yes, I'm coming to this. Let's see if you're interested in Egypt. So now when it comes to the big hospitals, obviously you need different type of hospitals. So sometime last year, I can't remember exactly when, but sometime last year, we were invited, Zambia was invited to Egypt for what was called Egypt and Africa Pharmaceutical Conference. I think it was the first time that Egypt had organized such a conference, which was graced by the president of Egypt. And there were 13 African countries that were invited to that conference, and Zambia was one of those. And I think these countries were strategically selected by Egypt because Egypt was trying to open up trade between itself and the African countries. And so Zambia was one of those African. And I went, I led a delegation, and I led a delegation of Ministry of Health, ZAMRA, the regulator, ZAMSA, the purchaser, ZPPA, the license procurement led organization, and the people went, and then also we tried some people from the private sector and from the university, students from the University of Zambia in the medical field also traveled. So it was a very big delegation which was led by the Minister of Health, and we spent some 3 days or 4 nights there. And whilst there, after attending the conference, it was clear to us that Egypt, it was trying to showcase its muscle in the pharmaceutical sector. And by the way, I think countries like Egypt, I think Morocco, in the northern part, they're like the giants in the pharmaceutical. And then when you come here to the south, you have South Africa, of course, and then I don't know another country in Africa. I think I can safely say South Africa, Egypt, Morocco, those are the big countries in the pharmaceutical industry. So it was very interesting. I learned a lot, of course, and I found that unlike Zambia, where we are talking of having 3 manufacturing industries in the pharmaceutical, Egypt has more than 400-500. They're huge. Just Cairo alone, with its population of over 20 million people, which by the way is the population of Zambia. Okay?
Yes.
For them, it is just the population of their capital, more than 20 million people there. And so obviously it's a huge country, and their pharmaceutical industry is very developed. So like we talk about Zambia being an agriculture, Zambia mining, and so for them the Egyptians also boast of a vibrant manufacturing industry, quality drugs, good price as well, and also very near because they're inland. You know, we are part of they're part of the continent, so it's not like you're going to far China or where it has to take months, for you to. So Egypt is like if you go there on the 1st of December, it means by the 30th of December, if you press your order, within 3-4 weeks, your drugs will arrive. So it's quite, short in terms of delivery. I also learned that what was also interesting was that at the time when we went to Egypt, they were manufacturing vaccines. These are COVID vaccines. And at that conference, the president of Egypt actually offered the participating African countries they donated some of the COVID drugs, and I think Zambia was offered 500,000 vaccines, like any other country that participated. And of course, I had myself as minister and leader and the team that I was with, we had a meeting with the Minister of Health of Egypt. And one of the things I said to him was that we were desirous to do business with Egypt in the pharmaceutical industry. One, we immediately wanted to purchase some drugs from Egypt. Two, we invited the Egyptian pharmaceutical industry to come and partner with Zambians setting up industry, even just packaging and all those kind of things, because we saw that Egypt was many miles away ahead of Zambia, and we had more to learn from them in that pharmaceutical. So that's the discussion that I had with the Egyptian ambassador, with the Egyptian minister. But this is from the background that in 2017, the then government of Zambia and the government of Egypt had signed a memorandum of understanding. Like, you know, you've seen these things which the president goes to this country, they sign in a particular field. So one of the fields which Zambia and Egypt had agreed to partner in was in the pharmaceutical industry. So using that, that's how we also saw that, yes, with our eyes, this was a good deal for Zambia. And so with that kind of thing, the matter was taken in. We came back, the matter was taken to cabinet, and cabinet resolved that in the circumstances, we needed to do at least a one-off huge purchase, bulk buying of essential drugs from Egypt. Okay?
Yes.
So with that decision, that this is how we're going to do it, we then resolved that we're going to get from Egypt. And this deal that was agreed was a government to government, because it was being negotiated at that level. Okay? One, the government of Egypt were going to help us with some donation of vaccines, just like we're getting vaccines from different European countries. You know that most of our vaccines that helped us to reach over 70% of COVID vaccination were donations from various donors. Various countries came through to support us. So Egypt was one of those countries that wanted to support us. But for them, we ourselves, it's not them, but we, through the Minister of Health, we did negotiate that we wanted also to be able to be supported to buy drugs. At that time when I went to Egypt, the Minister of Egypt said, well, here, the issue of drugs is a security issue. We don't just, like, So,
and that's what I wanted to ask. So can it be said that our government single-sourced the Egyptian government?
Yes, you can say that. You can say that. Yes. So when I spoke, because I was the lead person as minister, when I spoke to the Minister of Health of Egypt, he did say to me, in our discussion that Minister of Health in Egypt does not procure drugs. That's what they told me directly. Okay? Instead, they have an agency, a government agency. So similarly to Zambia, whereas Zambia also now the Minister of Health was no longer procuring drugs as Minister of Health.
Yeah.
So even the Egyptian minister said they don't also procure drugs as Minister of Health. They instead use a government agency called United Procurement Agency. Just like us, we have what is called Zambia Procurement,
Zambia
Medical, whatever,
ZAMSA.
Yes, ZAMSA. So equivalent to our ZAMSA, then they have the UPA that procures. And so they said, and the pharmaceutical industry in Egypt is driven by the private sector. So I can safely say that 99% of that is private sector driven. Okay, but the guys that procure drugs for the government is UPA, and that institution UPA reports not to the Minister of Health, but to the President. In fact, to the Prime Minister, because the gentleman who is the chief executive of that institution is appointed by the President, because for them it's a big industry, it's a security industry, a sector, so it is very well guarded. It's not like here where every Jim and Jack can bring anything anytime. You know what I mean? No,
Yes.
no, you know what I mean. So
and just on that point, haven't you annoyed quite a lot of these middlemen by going direct?
I mean, obviously, what do you expect? A business person, a minister decides to go to outside to go and procure from government or through government If it means that you are cutting off the middlemen, you are cutting off the whatever. Now, I want you to understand, that was not the major intention. The major intention is to stabilize the procurement, to stabilize the supply chain, the drugs into the country. Because remember last year, we had 3.4 billion from January to December. And all that money, ZAMSA was given that money, and all that money, ZAMSA bought locally and locally here from the manufacturers, the few manufacturers, and mainly also from all these middlemen who are importing drugs. You understand, both Zambian and foreign. That's where they bought. But did the purchase get stabilized? Did the supply chain get stabilized? It didn't. So I can't then sit back and expect that again from January to December, ZAMSA must continue with the same arrangement and expect that something will come out of that. Of course, as a responsible government, when you see that there is a problem there, or there's a problem of capacity, or there's a problem of the situation, because sometimes, even as much as ZAMSA advertises, chooses somebody, I've seen through the reports from ZAMSA, you find that somebody has been given an order and they've agreed that between February and October or August they will finish, delivering those supplies. You find by August maybe they've only delivered 40%. So what do you think ZAMSA will do? Either they'll be forced to terminate that contract, or they'll be forced to start looking at other avenues. So it's also not true that ZAMSA has not given orders. ZAMSA has given orders to people here and people outside the country. But sometimes the delivery of those goods have not been forthcoming. What the private sector have said to me in their complaint, they've said no, because ZAMSA has taken too long to do the valuation when they're supposed to do within 21 days. They've done 3 months, and the problem of the kwacha was at 14 or 17 to 1. Now the kwacha is at 21. So you don't expect us to accept to supply at that odd price. So we have told ZAMSA, give us a quotation in dollars. And ZAMSA says, no, we cannot give a quotation in dollars. Then let's negotiate the price. I said to ZAMSA, they have a point, negotiate. You know what I mean? Negotiate the price. Because obviously 6 months ago, what was the rate of the kwacha to $1? It was maybe 14, 15. Now recently, in the recent past, it went up to 21. So when they saw that the dollar rate has gone mad, they decided to fold their hands, but not to bring the goods, even if they had that order. Because they thought, even if we bring the drugs, at the price which we're quoted, we'll make a loss. So they're business people, they have to make business decisions. So when all these kind of things are happening, at that point, government has to intervene. To save the people. And so that's why we tried very hard to push the Egyptian deal. Now, Egypt is not the only country. We could have gone to America, we could have gone to Europe, we could have gone to, but the distance, but even some distance, South Africa is even near. But no, the decision at that time that was made was to Egypt, because we had gone to Egypt. I had not gone to South Africa, okay? And my understanding of South Africa has got good quality drugs. But I also know that the drugs in South Africa are not cheap, okay? And for me, at the time, Egypt was the right place. And also basing on the memorandum of understanding that was already in existence between Zambian government and the Egyptian government, we felt that our best way was Egypt. We also had some other programs between Zambia and Egypt that was agreed in terms of training, exchange, transfer of skills, and also getting some Zambians to go and train there, getting some Egyptians to come and work in our hospitals. So it was not only about drugs. My discussion with the Minister of Health in Egypt was not just about drugs. It was about various other things. It was about the donations, in terms of drugs like vaccines. It was about training, exchange programs. It was about drugs. It was about equipment. It was about certain research work between the two ministries of health.
And when we talk about the legal backing of this decision, is it in line with the ZPPA Act?
Well, let's talk about the issue of single sourcing, because this is a single sourced deal.
Yes.
The question is, is there anything in the act which says that you can single source? Yes, of course. Yes, there is. There is. You know, you single source for a very good reason. You know, single sourcing, you should be able to single source for a very good reason. And in this case, it is a good reason. Why? Because the situation in the country has not stabilized. Since we came, we did not find drugs, okay? And ZAMSA buying of drugs, bit here, has not helped us to stabilize, okay? Thirdly, we're looking at costs, we're looking at quality, we're looking at time. So when you put all those three factors, it was felt that Egypt was the right place. And that's how we went to Egypt. And whether there was something between Zambia and Egypt, yes, there is a memorandum that was signed that we should cooperate. There's nothing strange. Zambia has bought drugs from China. Zambia buys drugs from India. So Zambia can buy drugs from any country.
Has it been government to government in the past before?
Well, I don't know what has been in the past. I also know that in the past, issues of government to government has mainly been issues of donations from one government to the other government. But remember that in the past, Minister of Health was buying directly. So there would be no need for government to government because government was the one who was buying. In this case, the government is not buying. It is using an agency. And that agency uses the Procurement Act to purchase. Okay? So again, you have ZPPA, you have Minister of Justice, you have Minister of Finance. All those three institutions are supposed to help the ministry. They're supposed to help ZAMSA to ensure that we work within the law. Okay, and so sometimes you use a process that is shorter. For example, the issue of procuring using a single sourcing cell, you know what I mean? If you're dealing with government, it's one government. Why would I be advertising? Because I'm only dealing with one government. Okay, if I was dealing with the private sector directly, okay, then you'd have to advertise and try to get. The issue of procuring using the private sector was also considered. Okay? But because at the time this matter was discussed in cabinet, the decision that came out of cabinet, according to what we requested, was a government to government. Now, along the way, I'm sure you heard that there was an attempt to buy drugs from Egypt using the private sector line. Okay? That was attempted, but that was not allowed because that's not what we had agreed. What we had agreed was that we source for drugs from government. The reason why we opted to use the government line was, remember, there are over 500 pharmaceuticals. Zambia has not been buying drugs from Egypt. So basically that's more like a new market. Okay? It's not like India or China where we get drugs from. This was a new market and it was not a tested market. We felt that it was safer for us to deal with government so that the government of Egypt can deal with its private sector because they know better what they do with the private sector. We wanted the government of Zambia and the government of Egypt to work with each other so that it's easier. If there's a problem and we are dealing with that country at that level, it's easy for us to have a fallback. If there's a problem from Zambia, it's easy for the Egyptian government to come to the government of Zambia. So basically the relationship between Zambia and Egypt was at that level. And that level started with the ministerial, at the ministerial level. From the ministerial level, it went to the agency level. Okay? Somebody was talking about, no, the last time they went, they never saw any minister. Of course, there was no minister. So normally, if I travel to Egypt or any other country as a minister, of course at that level I'll be meeting my colleagues, minister. If a permanent secretary travels, he will be meeting people at that level. If it's a agency level, it will be at that level. Okay? If the president travels, of course he'll be meeting
the president
at the presidential level. You get the point. That's how that business goes.
So
there's nothing sinister about people going to Egypt and then meeting people at ZAMSA. Even here, people come They even want to see the minister, but the minister is busy. Maybe but maybe they are here in the country to meet a hospital like UTH. They'll go to UTH directly without seeing the minister, without even seeing the PS. But sometimes, so if a minister comes, it will be at ministerial level. If the minister is not there, maybe they'll just come and pay a school. I'll have no business with them. That's how the system normally works. Sometimes,
so what do you think is causing the noise? Because there's so much noise about this deal.
There's so much noise about this deal. The only reason for the noise on this deal, I'll tell you, is that this deal was started through the minister's office. Because the minister was the leader of the delegation that went to Egypt with the delegation and went and met the Egyptian minister and came back and gave the instructions and said, now the others now at the other level must go back to Egypt and concretize the deal. Okay? So, in their mind, they're thinking, oh,
you have personal
so
interest.
the minister must have personal interest because she's the one who went there, and spoke to whoever she spoke to, the minister. So they're thinking that maybe the minister has, because that has been the culture. When you're a thief, you think everybody's like you. You know how it goes. So even in this instance, maybe people think because the minister went to Egypt. But the last visit, I did not go. The last visit was led by the advisor of health to the president. He's the one who led, but he had Zamra, he had Zamsa, he had ZPP, he had everybody relevant. And these are open meetings. They're not secret meetings. Okay? The second point why there is so much noise is that some civil servants are used to making a 10% from every deal that takes place. So because this procurement is at that level of government, it's difficult. You know what I mean? There's no way, and I know, even as they went without me, I know that there's nothing they're going to make out of that. You know what I mean? Because the government to government. But the minute you bring in a private sector, it's possible for you or me or anybody to speak to the private sector and say, I'm giving you this deal, so at least you see I've favored you against that other company, so 5% for me or 10% for me. But in this case, they can't make anything. And I know that myself. It's not possible. So that's the noise. That is 1 and 2. The third noise is the pharmaceutical players themselves. In their mind, last year, the 3.4 billion kwacha went into their pockets and the procurement of drugs didn't stabilize. Okay? This year, there's 4.6 billion. They're thinking that 4.6 billion must also go to them. Okay? They don't care what happens, whether they are able or not, they're not able, whatever happens, as long as that money goes to them. So for them, it's like, the minister wants that money to go to Egypt. Let's fight it. That is the noise that you're getting. The only reason why the minister wants Egypt is simply that, we think it will be quicker because we're in this situation. We think it is cheaper. We think it is efficacious. So we think it is the right thing to do. That is all.
So even if the law enforcement agencies search and search,
they can they can search. Anybody can go anywhere. They will not find anything. Completely nothing. And I think they know that. But they want that money for themselves. They don't care about these shortages. They don't care about these challenges that we are facing. They only care about making money. That's all what people care about. Those that are in business, that's all they care about. And I'll tell you, there's been so much fight, so much fight. Like some of the things I can't even say them here because they'll just create problems for the country. But there's been so much fight. You've never heard how people can fight for nothing. They even organize, first of all, they started with trying to get the president to transfer me from that ministry to another ministry, So they were very nice. They just wanted me to be transferred. When they saw they couldn't win, they started finding a way to see whether, I went to South Africa for an operation. I had a reporter here. They started trying to say that I'm not fit to be in the ministry because that operation that I had normally affects the mental capacity of somebody. So maybe the president must move this person because she's not healthy enough. That's desperate. They got that desperate. If I tell you, you'll be shocked. Then they failed on that one. They went to the next. The next thing they brought up was a campaign that I'm corrupt, so I'm not good for that ministry. They went on with that campaign. They paid hired guns, you know them, to say all sorts of things against horrible things about me. That failed. So now they started putting pressure on the fact that there are no drugs. And whilst it is true that the levels of drugs are low, because remember, you can only be said to be doing very well if you're at 70 to 80% drug availability in the health facilities and at the center at Zamsa warehouse. So the minute you go down, it is said that you are not okay. But even with that, the truth of the matter, and this is nothing but the truth, and I can prove it using a record, okay? But it takes a bit of time, but I can prove it using a record. You remember that in the year 2020, 2021, there was actually a report that was done which showed that the drug situation was very bad in the country. It was about 35%. Okay? You remember yourself that at that time, when PF was in government, people were not even allowed to say that there's a shortage. If Ondam Zambians have a short memory, I don't know if, like you say, many people don't have interest sometimes in what goes around. But it was so pathetic, okay? There was a time when we heard that mothers were being delivered by guards because they had no health workers to do the deliveries. So the situation that time was worse than now. But when people speak, they say this time the situation is bad. If only people can be honest, even if some of the health workers themselves can be honest, they will tell you that for the first time, the hospitals are getting all what has been budgeted. Whatever we've budgeted has been delivered on time. And also there's been an increase. And also the issue of everyday corruption has reduced. Not finished, but reduced. And you can see that people are actually scared now to do corruption. It's not as easy as it was. You have to really push your way to do a corruption. And that's why you see people are fighting. So they're going to fight because we have locked them out. They cannot do what they were doing. Everything has to be done by the book. So obviously they're not happy. And they want to have a minister whom they can go to bed with. Who can play their game. I'm not one of those. I'm not their friend when it comes to things like that. For me, everything is just by the book, by the rules, and that's it. I run a transparent office. That is me. For those that know me, and they will tell you, I have no problem. I work with everybody. I'm not against any supplier. Every supplier is my friend as long as he knows what he's doing. But if a supplier is going to come to me and wants to be smart and wants to defraud the government, that supplier will not be my friend, obviously. And so normally people don't like people who are not user-friendly. I know some people have talked to me and they've told me, some of my friends who trust me, and they've told me, oh, I've got my friends who say, she's not user-friendly, we must get her out. You get the point? So user-friendly means, give a blind eye to wrong things and just allow things to pass so that things are easy. Recently, there was a talk about some drugs that were refused entry into the country. And I was being blamed about it. I'm not the regulator. The regulator is ZAMRA. That is also another body that you can say is also a statutory quasi-government body, an independent board. Okay, the board I appoint, the board appoints management that are only discharging their function. And so if ZAMRA as a regulator refuses to allow certain drugs to come in because professionally they think there's something wrong, how does the minister come in? How do I come in? I can't just pick a phone and say, leave those drugs to come in. I'll not do that. So when somebody comes to me, oh, no, minister, our drugs have been marooned at the border, please, and there's a shortage there. Yes, the shortage. I'll not allow that drugs must just come in. If the people who are supposed to test those drugs advise me and tell me, no, minister, these people lied, or these people gave wrong data, what am I supposed to do? Obviously, my hands get tied there. Okay? If they tell me, Minister, help us, the drugs are supposed to be cleared after 7 days, but you can push so that they do them within 5 days, make them work over the weekend, yes, I can give an instruction to say, please, can you work on Saturday and Sunday? We need those drugs. But I cannot tell them, allow those drugs to come in if they tell me there's a problem with the drugs. Now, I have no powers over ZAMRA in that respect, okay? And therefore, ZAMRA is only doing, as a regulator, it's only doing its job. What do? They come to you, the press, and they start singing against Masebo. This Masebo is wrong for the ministry, this Masebo is this. What people don't understand is that this is not the first time I've been in that ministry, it's the second time I've been in that ministry. And I was in that ministry when it was orderly, not this time. You get the point, where the whole system was just upside down. You get the point. It's not the first time. I was in that ministry when I was young, when it was ordered. I'm in that ministry when I'm more experienced as a public officer, and I found that ministry in a mess, and I'm doing everything possible to make that ministry become better. Those that are honest will tell you that it's no longer the way it was, but there's a lot more that we still need to do. So it's not just about the budget, it's also about human resource, it's also about drugs, it's also about equipment, it's also about governance issues, it's also about many other things, you know, participating with, working with the cooperating partners in a manner that is that breeds confidence. It's also working about the public themselves to make things better for the institution. So there are many issues there around health, and we're looking at the whole health sector as, you know, not just looking at one part of it, infrastructure or health or human resource, but we're looking at all the 7-9 pillars of health, you know, that really affects the health sector, so that at the end of the day, we are seeing an improvement on everything. Let's say tomorrow we get all the drugs at 80%. What are the people going to talk about? Will it be the end of health? That, oh, now they're drugs? No. There are many issues. Like I've talked about the first issue of human resource. There's also the issue of infrastructure. We want to get health service as close to the people as possible. And you find that the construction of health services in the country was not done in an equitable manner. You know, you find that there's so many structures in one district or one province against another province. This government is making sure that if we talk about infrastructure, it is across the board in all the 10 provinces, and ensuring that everybody, the national cake, small as it is shared equally. Because at the end of the day, Zambia does not belong to one province or 3 provinces. Zambia belongs to 10 provinces. So even as you discharge your function as a government, you have to ensure that you balance. And because the cake is not big enough, it is necessary, therefore, that you give a little bit to everybody, so that the disease burden is reduced in all the 10 provinces. And that is what we are trying to do. So like I say, it doesn't mean if tomorrow we have the drugs, and we're going to have the drugs. And then what? You think when you have all the drugs, then the story finishes? No. There's a lot of issues. There's an issue of the structure. When I was in that ministry, I think we only had 7, 8 to 9 directors. By the time I was coming back, I found a ministry which has 19 directors and deputy directors, assistant directors. Then you ask yourself, so what are all these people doing here at headquarters? The work is in the hospital. And some of them are professionals, good professionals, for example, for that matter, who should be in the hospital. You were talking about no skilled workers in the hospital or doctors in this, because some of them are doing administrative work. But I'll tell you that at the time we took office, we found that the previous government had already done a structure. I think the last minister, who is Honorable Chanda, Dr. Chanda, I think he himself had seen that there was a problem of the structure. And so at that time they decided to get the whole structure redone. So between the Ministry of Health and Cabinet Office and PSNB, they came up with a new structure for the Ministry of Health. And that structure was adopted by the government then. And that structure, when we took over, was at the point of implementation. And in fact, we have delayed to implement it. And that has been a minus, and that has been a problem. We should have implemented it 3 months after we came into office. But this is 1 year down the lane. 1 year, 7 months, the structure has not been implemented. Why? Because people don't want to go and work out. Everybody wants to work in Lusaka. Everybody wants to work at the headquarters because they think that's where the money is. Okay? They think that's where the cars are. They think that's where the aircon is. So everybody's crammed up at the Ministry of Health. And when you go out in the peripheral areas, the peripheral districts and provinces, you find there is none there. Somebody was telling me that we have about, I think, 3,000, over 3,000 doctors, and of this number, 2,000 are in Lusaka. 1,000 are across the 9 provinces. That is not desirable. There was an attempt to take some doctors into the rural areas so that we can give better service. I think that the problem was that the doctors that were asked to go protested, and they appealed to my office to say, Minister, we are being transferred. There are things that need to be discussed. We have not discussed. We have not been consulted. We are owed settling in allowance unless we are given this, unless we are given this. I thought they had a point. What we need to do is to sit down. So now that I have a team, a new team of permanent secretaries, that is something that is urgent on our desk. But whatever we are going to do, we are working with the associations, the different associations. Remember that Ministry of Health is not just about medical doctors. They're also nurses, they're also lab people, they're also this, they're also that. So all these associations, we've already started engaging them. So that
and finally,
so we've all started, just before I lose sight of that point, we've started engaging them. And I think that in terms of principle, we are all agreed that we have to get people out into the periphery. But we have to agree, we have to look at some of the demands that they're making. Some of them are genuine, and so within the framework of our expenditure budget, we will be able to discuss and agree on certain things. But we are hopeful that in the next few months, we should be able to start moving doctors in the rural areas throughout the country, so that every province must have some good number of doctors. Every district at least must have a doctor. That's what we're going to do. So that process also is started. But again, even before that is implemented, you hear Masebo wants to remove people from the Ministry of Health.
And that's what I wanted to ask. Finally, Honorable Minister, you mentioned having a new team of permanent secretaries. The President has fired 2 so far. And some people are saying maybe it's not the PSs who are the problem, maybe it's you who is the problem. What would you have to say to those people who?
I think that the President fired the first permanent secretary. I think the second permanent secretary was redeployed. I think that was the statement that I heard.
Yes, redeployed.
And what can I say? The President moves people. And of late, if you've noticed, he has been moving permanent secretaries. That does not mean that we as ministers, we are the best, there's no problem, no. Okay? So he has to start by moving maybe a minister, or decides to move a permanent secretary to see whether things can improve in that particular ministry. If things have improved, I'm sure he's happy, everybody's happy. If things don't improve, he can also make a decision that no, let me also try to move a minister and then bring a new minister. Then also he will see whether that new minister is improving the situation, then he'll say good. If he sees that minister is not also improving, he has all the right to change. You make changes, it's like a football game. Sometimes even a good player may not be that good because of other reasons, or maybe that day his foot is not working well, or maybe he has put on too much weight, he's failing to run. So he has to find somebody who is lighter, who can score, or who can run and make the team to win. So basically that's what the President is doing. And I don't think that means anything. Even ministers can be moved, permanent secretaries can be moved, directors can be moved. The civil service laws are very straightforward. Even when you get employed, you sign and say, I'll go and work anywhere. Especially when you're a teacher, you're a medical officer, you're an agriculture extension officer. That is necessary to move people. Because when somebody, even policemen, when somebody sits in the same job for a long time, you get used to that system. And sometimes they say that familiarity is not good in anything. Or overstaying in one job is not good sometimes. Sometimes it's good, sometimes it's not good. So it's up to the appointing authority to decide. And there's nothing new about it. There's nothing, So the movements in the Ministry of Health are normal. Okay? Of course, the president doesn't enjoy moving people every day. He would like to get the same team for a long time. But if that team is not gelling, is not doing something that is pleasing to him, he will make changes. And that doesn't mean that he doesn't like me, But if I'm fired because I stop, yes, then there's a problem there. You should worry. But if you're just changed around, it doesn't mean that why have you moved? So somebody also can be moved because you can be good in netball, but you will not be good in football. Okay, you can be good in the Ministry of Health, but you may not be good in the Ministry of Finance. So this is a new government, and this is 2 years down the lane. We're almost at 2 years, isn't it? We're 1 year and a half. So it means that the president needs to keep trying the team that he's building until he gets to a point where he's satisfied. So under Ministry of Health, obviously, things have taken long to stabilize. And then the question that you're saying, they miss the minister. The minister is a policy maker, okay? And so when there is a problem in a ministry, I think it is only right to start by blaming officers before you blame the minister. Because the minister can even be ignored. You ask for a politician, and anybody can be minister of a politician, any politician can be minister of health, and the ministry can work. It's not just about the minister, it's about management. It's about the people that are implementing, because the manifesto is known. For example, ZAMSA knows that it must buy drugs. So how does it become a problem of the minister? It cannot be the problem of the minister if the minister has not given money as they promised, but the money has been given by the politicians. It's not the minister to advertise, it's yourself. The minister doesn't sit in the procurement. If I tell you that I don't know, what they're doing in that procurement, I don't sit there. They don't even report to me. I get to hear sometimes when I see something in the press. Then I find out, what about this story? You recall when the Vice President of America was in Zambia, they put a picture on Daily Nation and said, there's corruption at the Ministry of Health. And they put my picture there. You can see it's all politics at play to try and paint the New Dawn government as if it is being led by ministers and a president with ministers who are criminals like themselves. Okay? You had the story of the Minister of Finance. You had the story against the Minister of Infrastructure. And those are just stories to try, because social media, when people read, they think it's true. So they've achieved their goal, to paint you black, Instead of just going to the anti-corruption and say, we have information about the Minister of Finance, this is what happened, they go and make a story. And then people read and people think it's true, when it's not true. So those stories, because really a person who has evidence over anything, he will just go straight. You don't need to take it to social media. You take it to social media when you are sure that you have reported and that corruption are not doing something about it. Then you can say, I reported the case that corruption are covering up. So there is nothing like that. And coming specific at your point and say, now that the president has put in a new team, do you think that this new team will work? I'll tell you that the new PS for administration, Professor Christopher Simonga, at the time I was in that ministry in 2006, he was one of the directors there. He was actually in one of the departments, and an important department of policy of health policy, planning and budgeting. That was the department he was in. That was the time of the likes of the Vilepi Mutonga. She was one of the directors there. There was Simon Niti. There was Ben Chilwa. That time, the Ministry of Health, in terms of staffing levels, although they were in small numbers, the few small numbers were quality officers. That's what I remember myself. They had a history. They came from somewhere, So this new team that I've found, there's a new team. Some of them, they are becoming directors for the first time. Some of them, if you look even in their files, you ask yourself, is this supposed to be a director? But I think what is worse much more than that is that you have a ministry that has 19 directors, and even years of 19. What would I be doing 19 directors? Doctors doing what? So we are going to reduce. In fact, it was reduced under the PF to about 9 directors. So basically, that is the clearing that we are going to find us doing in the next few weeks to come with the new people. So the team that is there has experience. They're not new people. I've heard people saying, oh, they want to remove a director, it will destabilize. Where do you hear about that? Even when I move a director, bring another director, I'm not going to move a director and bring a waste director. No, I'm going to remove a director, and the next one I'll bring must be better than the one I've removed, isn't it? Unless I don't know what I'm doing, as government. So, and it's not Masebo, but of course, because I'm head, I take responsibility of everything. But if you see the fight against this minister, you even laugh. Sometimes I just laugh. 2 days ago, there was a headline article by this hired press called Daily Nation, and they had a story that patients have gone to strike. In Chilenge, patients are striking, are on strike because there are no drugs. I just laugh. They're so desperate. People are so desperate. They're so desperate to the extent that they're prepared to give false information because they know people are not verified. I asked the provincial director, I said, can you please check, what is this story I hear about? The man went there, and the officer says, we don't know what they're talking about. They're not patients. So somebody went and organized hungry people and paraded them as patients are protesting that there are no drugs. Of course, people are right. They have the right to protest for anything that they're not happy about. I can't stop them. But it must be true. It must be in good faith, not to try and influence somebody. And if you know President HH is not one of those weak leaders who will listen to a story. Many tell him stories, starting from ministers, MPs, politicians, colleagues, diplomats. Everybody tells him stories. But he has his own mind. He's a very sharp man. And that's why you see he's very slow. And people even get upset that he's slow because he has so much power as a president. And if he's going to listen to every story that comes, without verifying it, then he can get people killed, isn't it? So as a head of state, you have to be steady. He's a very methodical person. So do you think that you who is outside can know that Masebo is corrupt and HH can't know that I'm corrupt? Really? Then if he doesn't know that I'm corrupt when I'm really corrupt, then something is wrong with the system. Okay? So he hears, he investigates. And when he finds that truly this Milupi that you have said is corrupt, he will fire. Okay? But he will not fire somebody because you have engineered, you have paid somebody, maybe even some officer in State House to whisper to the president that minister is corrupt, or you have paid a friend of yours to do that, or you have cheated, you've used some forces, including using donors, to go and whisper to the president and say, oh, that minister is corrupt, and you think that will sell. They're wasting your time, not the president. When he is sure of what you have told him, he will act. But if you see him not acting, it is simply that he realizes that there's malice here. You can see that this is malice and people are doing politics. But when there's truth, he's going to act. That's what I can say. Lastly, I just want to say that the challenges that the sector is facing are known. We have in place the UPND manifesto, which is very clear. My vision for the ministry is anchored on the vision of the president to ensure that 1, we have enough staff, 2, we have enough drugs, 3, we have equipment, 4, we construct more facilities, especially in the rural areas, so that the distance is reduced, and 5, we improve the referral system by ensuring that we have enough ambulances so that people that are sick at the lower level can quickly be referred on time, and so that we can save lives. And above all, you know that this government is seriously implementing the decentralization policy. I think we'll talk about that next time, but I think I just want to say that this is a policy where power, resources, staff and functions are being moved from Ministry of Health to the facilities, that is to the hospitals, through local government. So all the powers or the officers that we have at the district level, starting from the health posts, the clinics and the district hospital, that level of hospitals will be handed over to to local authorities in every district, so that people don't have to come to Lusaka to look for the minister or the permanent secretary to deal with simple matters. Okay, that some of those issues can be dealt with at that level, so that the Zambians themselves can decide on their budget, how they want to use that budget, how they want to improve the health delivery system. And so the issue of no capacity will not arise, because as we give this function to the local authorities, we'll also give them matching resources. We'll also hand over the officers themselves, the skilled doctors and the nurses and everybody will be handed over to them. The equipment, the infrastructure, the assets will also be handed over. What that will do is that we are trying to get power to the communities. And if you are given power, like you've seen what has happened with CDF. CDF is a game changer. For the first time now. You saw even today, like when we were in Chong, we are able to support families that lose their loved ones in such in a tragic manner, where you're not prepared. The government can come. In the past, they would have suffered on their own. So many things now we want them done at the bottom, at that level. And that's why you're seeing more resources, you're seeing more functions going to them, you're seeing more assets going to them, so that their livelihood can actually be improved in the long run. So we will be working through decentralization in the next few months to come. We have already started right now, and many ministries are going to decentralize. And one of the key ministries that is decentralizing will be the Ministry of Health, whereby health facilities at that level, construction and all. One of our flagship projects for this year is the issue of construction of annexes, maternity annex. As you know, the rate of maternal deaths arising from pregnancies have increased in the country. We are losing many mothers, we are losing many children, babies at birth. And one of the issues is that at that level, things are not okay. They, either people have to walk long distance. By the time we try to refer them to the main hospital, people are dying. So what we are doing is we've started with the construction, the extension of all the health facilities by putting up a maternity annex, so that at that level in the village, we should have a midwife that must help this village woman to give birth without any complication. And if a complication arises, there should be a midwife at that level to deal with that issue, unless for something that is bigger. And then we must have transport, ambulances, to be able to transfer that mother to the nearest higher health facility, so that if it's a transfusion of blood, so that it is done, because if you delay, somebody dies. So basically, those are the things that we are going to be doing in the few months to come, in trying to improve the health sector.
Thank you so much, Honorable. I think we've learned a lot this evening, and thank you for watching. To everyone who has watched, next time we'll delve into the National Health Insurance, which is NEMA, which a lot of people need to subscribe to. We'll also talk about the decentralization. So thank you so much, and see you next time.